Our topic for today's webinar is how to develop a trusting and fruitful relationship with students, part 1. Our presenter for today's presentation is my colleague, Julie Hamilton. Julie is a nurse educator consultant for Kaplan and has more than 29 years of nursing experience working in clinical practice and nursing education. She has served as program chair, consulted in the establishment of new nursing programs, developed course curriculum, taught in PN, ADN, and BSN programs, and has been a professional presenter at local, state, and national levels. I will turn your attention over to Julie Hamilton at this time.
Thank you so much, Dawn. Hello, everyone, and welcome. Tell me how you're doing down in that chat. How are you doing today? Let me know in that chat how you're doing, how you're feeling, because today I'm going to ask you to participate in our presentation. You're doing great. Oh, Hawaii, fabulous. Excellent, doing pretty good. All right, well, I'm bracing for our Florida, all of our Florida people. So I'm keeping them in my thoughts. So hopefully they're going north and they're all going to be safe. They're all going to be well. So let's talk today about what we're going to do, what you're going to learn. So Nettie Lucas had been scheduled to be your presenter today to talk about how to develop a trusting and fruitful relationship, but she wasn't able to be with us today. So what we decided to do, instead of just canceling the event, I'm going to do kind of a segue into her presentation. And with that, we're going to talk about basics of building a relationship. And she will dive more into kind of the do's and the don'ts related to the relationship. So I want you to embrace yourself. We are going to learn a lot today together, but we're going to kind of keep it on the basics. So we're going to talk about establishing steps in building trust, and we're also going to be talking about making a connection. So tell me your thoughts in the chat. What's trust? What is it? Is it a feeling? What are your thoughts on trust? What is it to you? Because that's important. When you don't have any fear. Oh, I like that. Yeah, okay. No fear in sharing information or anything. Well, what's a connection? What is that? Believing in someone. Excellent. It's a feeling and a believing. All right. A belief of reliability and honesty. Oh, I love all these comments because I want you to stop. And even though we've built relationships throughout our life, I want you to really think of the basics of these. What is trust? How is trust established? How do we really truly make connections with one another? And that's what we're going to explore today together, is really looking at the bones of this. So with every great presentation, what do we always like to start with? Statistics, right? So a Gallup poll is completed every single year. And they completed one last year. They'll complete one this year. But did you know that nurses are #1 for the trusted profession? So last year in 2023, the poll, of course, we did the United States, and 78% of those that took the survey say nurses are #1. And we are way above the second, which is veterinarians, and they're about at 65%. So we are topping the charts. Not only were we #1 last year, but we have been #1 and been at the top for 22 consecutive years. That's fabulous. So now I've got to think, why? Why are nurses so trusted? I want you to also realize that we peaked in 2020 and we're down 11 points. So in 2020, we were at 89%. So let's stop for just a second. What are your thoughts? Tell me in the chat. Why are we down 11 points since 2020? What do you think? Okay, COVID. So good. Yeah. After COVID. Okay, COVID, but why? We peaked in 2020, which was that kind of peak of COVID, right? But why are we down 11 points since then? Ah, Rachel, I like that. Yeah, people's lost trust in healthcare overall. All right. People are too busy to answer the poll, maybe. Yeah, I like that. Yeah. Isolation, no contact care, more digital activities, politics. All right, there can be a lot of variables related to losing trust. But what is one of the most significant things when we lose trust? Is it hard to get it back? It is hard to get that trust back once we lose it. So I want to talk about that today. And I know we all know what this is, but as a new educator, even a seasoned educator, I want to take your mind back to really thinking about trust. So let's look at some of these factors. Now, this slide's really busy, and I wanted to make it really busy because I want us to really think about why we're losing trust. Is instability a good word of what we've been through for the last 4 years? Does it feel unstable? Yeah. Do we start to lose trust when we don't feel as stable as we usually do? That we don't have the norms in place, right? So, what are some of those factors? It can be social factors. It can be political factors. You guys were hitting on this. It could be economic factors, safety, security. It could be related to our isolated communication now. So, let's look at these pictures. When trust is broken or we've lost it, there's a fracture. We've got a fracture. And the fracture is building the relationship with others because once that trust is broken, it's hard for us to be vulnerable to give ourselves to others or give ourselves to the world. So when we look at some of these factors, think about the political unrest that we're feeling, not just in this country, but all over the world. Think about COVID and the impact of COVID, what we all experienced during COVID, and how that's changed us, how it's changed the world, and related to trusting again. Think about how we get information. We get information now from a lot of different varied sources. Do we sometimes get false information? And do we lose that trust? Yeah. Think about how we connect with one another and how we communicate with one another now. Most of the time, we're communicating with these smart devices, right? We're losing the face-to-face interaction. We're feeling freer to say just what we feel in a quick instance based on a reaction that we see or a post related to the social media, those types of things. And this can cause some fracturing in our relationships and trust because we're kind of isolated in that communication where we just have our cell phone. We may just be in the living room by ourselves and we're feeling a little bit more freedom to express ourselves because we're not face to face. When we do get face to face, sometimes it leads to arguments and we're all really frustrated because of this instability that we're feeling. I want you to think of the violence that's occurring. And when I say violence, the violence that's occurring kind of in our educational institutions, related to mass shootings in schools, related to that safety and security we once used to feel, but now we're not feeling it. I want you to think how this impacts our students. So the generation that is coming to nursing school, they've grew up in a different age. than possibly we did. They grew up in the digital age. They communicate better per the smart devices. They're digital in everything they do and everything that's stimulating their brain. Think about them walking into a school and think about you walking into a school. And some of you've probably felt this if you're a new educator and thinking of that unrest that you felt, that it's not just, oh, I'm worried about the test today. You're worried about someone coming in and possibly harming you, physically harming you. That's a different trust. So when we think about that, and we think about the generation that is coming into nursing school right now, they're very vulnerable. They're very frustrated. They're very leery. They feel that things aren't stable. They don't know what's going to happen at any moment. And this is something we've not seen. We've not seen before, but it's impactful in the relationships they build with others. As new educators and as seasoned educators, we have to understand that vulnerability that they're feeling and that instableness that they have. We also have to understand sometimes that they isolate themselves, because during COVID, we all isolated, but they isolated even more related to maybe being in middle school, possibly high school. They were not really in that social gathering where they were face to face with other students. And so that isolation can take a toll on them where they don't trust as much. All of these are impactful. I also want you to think about nurses. Nurses these past 4 years. What are we seeing in the nursing profession now? Are we seeing a lot of nurses getting burnt out? They are. They're getting burnout, right? Yes, they are leaving our profession. They're not just changing disciplines or changing the field of nursing they're going into, like ICU to home health. No, they're getting out of the nursing profession completely. This is impactful for just the public, the healthcare system itself, but it's also impactful for nursing education, because when they're leaving the profession, we're not seeing additional educators come in. So not only is there a nursing shortage within the clinical space, there's a nursing shortage within academia. What does that do to all of us? We've got more work. We've got more workload, right? If there's less people, we're going to have more work. So you as a new educator and even a seasoned educator, this is very impactful for you because we're losing that trust. We don't have enough people to kind of help us. And we're seeing that globally, not just in the nursing profession, but even in service, as far as restaurants, that type of thing. We're not seeing a lot of people influxing into those service type of job opportunities. And so there's less people to provide less services. So we really have to think about how that impacts our trust and how it's fractured and how we've got to get back to having a stability so we can foster that trust can build. Because again, once it's broken, it is hard to get it back. So now let's talk about you. And this is a novice nurse educator series, but some of you are seasoned educators, and I'm glad that you're with us. But let's really think about being a new educator. Everything is new. So maybe you were practicing nursing for 20 years, but now you're in academia. That's a completely new transition. And with that, when we transition into a new role, let me know in the chat, how does that make you feel? When you've been doing something maybe for 5, 10 years, and you know what you're doing. How does it make you start feeling when you go into the new role? You get nervous. You get uncomfortable, don't you? Yes, you do. You can get frustrated really, really quickly and easily. You feel like you don't know what you're doing. You feel lost. Absolutely. Apprehensive. Right. You kind of, if you're a real big extrovert, you kind of become a little introvert, right? Because you kind of back up a little bit. You don't feel as confident because it's a completely different new role. It's a completely different new situation. Everything is coming at you. So you've got to do maybe theory, didactic, you've got to do clinical, you've got to teach the lab, you got to learn simulation. And being an educator in academia is completely different, well, not completely, but slightly different than being an educator at the client's bedside because you're working with students. You're not just working with a client that's getting ready to be discharged and go home, right? You're going to see that student day after day after day. So sometimes it makes you feel like you've been thrown in the fire. All right. There is a whole new language to learn. You got it, Mary. So I want you to think about that because when you're thrown in the fire, and we just talked about all these variables that we can lose trust and that fractured trust. When you're thrown in this fire and you start getting overwhelmed, you start getting anxious. Sometimes it feels like this picture on the right. Does it feel like you're in a pressure cooker? And things are just building and building and building. You once knew what you were doing and you felt confident, but now you're in a new role and man, it's overwhelming. Sometimes we feel like we're just going to burst, right? It feels like being a new nurse all over again. Again, that's your vulnerability. You feel vulnerable. You felt confident before in the position that you had. Now you're feeling some of that vulnerability. I want you to remember, as an educator, your students are feeling the same way. They are overwhelmed. They've got so much to do. They feel like they're in this pressure cooker and they feel like they're going to explode as well. I want you to think about this picture of this tornado on the left. We want to be in this meadow and we want to be on this grass and it feels good and we feel safe and we feel comfortable and we're trusting. But when we're overwhelmed, it feels like we're in a tornado and we're just spinning with everything. So what do we need to do? How can we really start gaining back trust, feeling more comfortable, feeling more stable to where we feel like we've got some control? When we look at this tornado, sometimes we have to think about things are going to be spinning. There's going to be things coming at us and flying around. But sometimes we've got to stop, get out of the spinning, and get in the middle and watch things spin just for a second to catch our breath. And a lot of times we don't catch our breath. We don't do it as nurses, and sometimes we don't do it within our life. And most certainly as a new educator, you just keep doing what everybody's telling you to do because you're just trying to get through each and every day. So I want to give you a quote by Dr. Martin Luther King Jr. Whatever affects one directly affects all indirectly. I can never be what I ought to be until you are what you ought to be. This is the interrelated structure of reality. Tell me in the chat, what does that mean to you? What is this quote saying to you? Especially in the context that we're talking about with trust. Butterfly effect. We are one. I like that. Yeah. I can be affected by others. And can we affect others as well? Absolutely. Become your best so I can become mine. Oh, I like that. Yes. Excellent. And so we're in it together. We're not alone. We can directly impact each other, but we're also responsible for our own actions. Now, when we correlate this as an educator, I want you to remember your student, but I also want you to remember your co-faculty, your colleagues that you work with, because this is a new dynamic that you're in. It's not your staff that you're working with. It's not the client you're working with, but you're working with a whole different dynamic when we talk about students, we talk about faculty, and we talk about academia. So one of the things I wanted to talk to you about today is when we feel like you're in this tornado, we feel like we're in this pressure cooker. I want you to always think pause and prime. Now, what do I mean? Well, you guys know what pause means. Take a moment and pause. Okay, what does prime mean? Think of priming an IV. What does that word prime mean to you? Prepare. Ooh, I like that. Getting it ready. I like that. Prime, recharge. Prime also means first, right? The prime deity. It also means most important. It can also mean in my prime, in my best, right? Prime also means preparing, getting it ready, like an IV. We prime an IV. Why do we prime the IV? Why do we prime an IV line? Flushing out the stress. I love that. Yes. Okay. Are we getting rid of all the air? So what goes into the patient is that fluid or that nutrient or that blood or whatever we're giving the client. Yes. This is what I want you to think about yourself, but not only yourself. The things that you do, you model to your student. This is different than clinical setting. You see your patient for that day or that shift, and then you may not see that patient again. They're not seeing you consistently, day after day after day, week after week, month after month, year after year. So I want you to think about role modeling. And when you role model, I always want you to think, okay, when you feel like you're in this pressure cooker, you feel like I'm in this tornado, things are spinning. We've got to pause for a minute, and then we've got to prime. We've got to be our best. We got to prepare. We got to make sure whatever that we output is good, because garbage out, garbage in, right? Garbage in, garbage out. We've got to make sure that we establish a safe communication place, a safe environment. And so everything we do, I want you to think about self-reflection. Stop and think, what is happening to me right here, right now? What's going on? Become self-aware. Gain back self-control. And then self-regulate. Now, I know you all know this. You've heard it before. But we've got to be intentional with it, because we've got to gain back trust. Generally, think about COVID, and we went through COVID. We reacted to COVID, right? We reacted to it. So it all overwhelmed us, and we just started reacting with what we needed to do. I want you to think about planning and preparing. So when we're thinking about self-reflection, self-awareness, self-control, self-regulation, I want you to be proactive. I want you to start thinking about responding and not reacting. Because when you have a class and maybe you've got 30 students, maybe you've got 100 or more students in your class, you're going to want to react. And we've got to step back, we've got to pause, we've got to prime, and we've got to respond. Because what we need to do is build and establish that trust so we can have a meaningful relationship with our students that impacts them. And sometimes we don't think about this because we are just trying just trying to get through the daily grind. But we really have to practice this. And when we practice it, we also have to get students to practice it because we're all feeling this instability. And together, we can make a difference in how we build these relationships and get that trust back. I want to talk to you about something called emotional intelligence. Tell me in the chat. Know anything about it? Have you heard about it? Anybody know anything about it? Empathy. Okay, Colette. Yeah, it is. It's based on some empathy. Emotional intelligence is not really fairly new. So Peter Savoy and John Mayer, not the singer, they created the term in 1990. They published an article and they created the term emotional intelligence. But it didn't become popular until about 1995 with Dr. Daniel Goleman, and he created a model on how we could measure emotional intelligence. And then, did you know that emotional intelligence, there has been a book for nursing published for clinical practice, and that was by Estelle Hodier. Now, Estelle published this in 2020. So what is it? What's emotional intelligence? Well, I want you to think about cognitive intelligence. What's cognitive intelligence? It's the way we communicate and we gain knowledge, right? We want knowledge and feed our brain with the knowledge. But the thing is, you and your students, you're not going to be able to retain that knowledge if you're in the pressure cooker, if you're in the tornado and things are swirling. Because you can't receive the knowledge and bring it into the brain and then be able to think logically and make decisions that are going to be good, that are going to be safe. So emotional intelligence, it makes us stop and it makes us think about our feelings and our emotions. Now, I know this sounds warm and fuzzy. Why are you telling us this, Julie? Because it is important, and it's important in our day and age related to that student population we are seeing going into our universities and colleges. It's also important for us because we have been through chaos. We've been through this instability. And so there are two main points that go with emotional intelligence. One is related to self and one is related to others. So related to self, we have a personal responsibility to be aware of and understand our own emotions. So with that, sometimes we may react, or even talking to family, we may react to them based on something that happened at work. Has nothing to do with that specific family member, but it was because you just had a really stressful day at work and you react emotionally. We're human. We do that, right? We do. But emotional intelligence is making you be accountable for those emotions. You stepping back, pausing and priming, and start being aware of and understand those emotions and how they're impactful for your well-being and others' well-being. It's also related to your personal responsibility of independently expressing our emotions effectively and in a safe, direct manner. Now, this is important because we want to be able to recognize the emotion, but be able to express it. And when I say independently, I mean that we take accountability for our emotions. So Dawn didn't make me feel this way. I'm feeling this way. And how am I going to react to that? How do I get control of that? It also allows us to think about managing the stress managing that pressure cooker successfully, with being flexible and responding with positive actions. Again, we need to pause and we need to prime. So we need to pause, we need to think about it before we respond. We don't want just to instantaneously react. Now, the second part is also looking at others, and this is really, I think, impactful. This is our social responsibility to be aware of and understand how others are feeling in this situation. That's that empathy, right? Putting ourselves in their shoes. We want to engage cooperatively with others in a contributing way. Now, that's important. It's not just us having a relationship and just getting through the day by day kind of task. No, we need to be contributing in some way with the collaboration that we have with others. And we want to establish a connection that's influential and meaningful. Now, I want you to think about your students. You're establishing a relationship with them. You want that relationship to be meaningful. But there can be all kinds of things that's going on with that student, that they're inside that pressure cooker, they're inside that tornado, their life is a whirlwind. Maybe they're paying for college all on their own. They've got 3 jobs and they're still trying to come to your class. That puts a lot of pressure on that student when they walk into your classroom, just like you walk into your home and you've had a stressful day. Sometimes we're getting all of that kind of feedback from them. So it's important that we practice the skill. We get students to practice the skill, just like I had that slide before, becoming self-aware, having self-control, managing ourselves. We got to practice these skills to establish relationships, but maintain them. Get that trust back, to solve problems, to lead effectively and efficiently, and to build resilience. Now, there's a lot of information on emotional intelligence. There's a lot of information on trust. There's a lot of information on building a relationship with your student as an educator. But one of the really great things as I was reviewing this literature is that we've lost our resilience. And that's how we're losing trust too. Resilience is like you standing up and facing it, but also being able to get through it. And we've got to get the resilience back. We do, and we also have to make sure our students are resilient, that they can push through and they can get through it, and they can stand up and they can encounter anything that comes at them. Because as a nurse, we've got to get them ready for that practical application, that environment. So how do we build trust together? With faculty and students, I want you to think about being authentic. Now, a lot of times we just think, well, I don't really want to, tell the student who I am. They're going to know if you're faking it. So you want to be real. You want to be true. You want to be transparent. If you don't know something, you've got to say, I don't know what that is, but let me find out and I'll get back to you. You are unique and you want to share your uniqueness. You want to uphold your integrity. Now, what I mean by that is your values, your boundaries, your limitations. That's very important, especially when you've got a room full of 100 students. You also want to express humility, that we understand everybody is going through all different types of situations. Now, sometimes you look at this and you think it's kind of like a client situation. It is. You want to be therapeutic with your students, but you've got to have a different type of communication with your students, which needs to be professional. So this doesn't mean that you're just spilling out all of your life things or all of your values to your students. You've got to have those boundaries. You've got to have those things that you, as an educator, say, yeah, I'm not going to share this or I'm not going to share that. Because we have to think about that influence to others. You want to be confident. Now, as a new educator, that confidence is low because you're learning the ropes. But become competent. If you don't know it, find out how to get it. Become qualified. You have a lot of experience behind you as a nurse, or if you just came from you being a student yourself, you've got a lot of knowledge and experience. So you're qualified to do what you're doing, but you want to uphold that professional and you want students to know that you're competent and qualified as well. I also want you to think about your potential and your progression. Now, this isn't just for educators, this is for students too. Students come with this vast uniqueness of experience and knowledge, and we want to really use that in our educational experience as a nursing student. So sometimes students feel like they're just not good enough, they just don't know enough. But we can push them, we can propel them, that it's about progression and about their potential. And then trust, we got to be reliable. We got to be there. If we say we're going to do it, we do it. We've got to be consistent. We've got to recognize our own biases. We've got to make sure that we have fairness. So consistency, making sure you're adhering to the code of conduct for the student, making sure you're adhering to policies and procedures. You're not giving a little bit leeway for one student and not another. So you have to be consistent. You have to be responsible. You want to be stable and you want to be solid. All of these you role model so your students can role model them as well. We're seeing a lot of students get into nursing so they have a stable job, not necessarily for being a servant. Some are, they're in to serve and help others, but a lot of the influx is really different backgrounds that we're seeing coming into the nursing profession. So we've got to embrace that, but we also have to make sure that we're showing them how to be authentic, showing them how to be confident, showing them how to be reliable and showing up. So now let's talk about making a connection. We've got to make a connection. We've got to build trust, but we've got to make this connection first to even start building and establishing that trust. One thing that's really changed in education is a teacher-centered environment to a student-centered learning environment. And what I mean about that, it's all about others. It's all about that student, what that student needs to learn, the goals of the student, the objectives they need to learn and obtain. And so as an instructor, it's not about me standing up and saying and talking about all the content that I need to get out there for the student to know. A lot of times we put that on ourselves, that we are the ones that just got to pound all this information out so the student can have it. We've got to have a different approach, and it's got to be student. And I want you to think about this as your clients. We make goals toward the client that are smart, they're specific, they're measurable, they're attainable, right? They're realistic, and they've got a time frame so we can evaluate it. Same thing when we're thinking about academia and a student-centered learning environment. It's about the student. It's about what their goals are. It's about what they need to learn, not about what I need to stand up and do. Now, we have responsibility. We've got to make sure that we're educating our new nurses appropriately and effectively. But we've got to go at this a little bit different. It's not about me standing in front and all the things I need to do. Think about that as a nurse. When you were a nurse and you were practicing, was it all about the tasks that you had to perform? Those meds, all the things, the charting, all the things that you had to perform. When we initially become a nurse, that's what we're doing. We're in the tornado and we're just spinning and we're just trying to get the task completed. That's how you're going to feel as a new nurse educator. But it's not about the task that I've got to perform. It's about that client and their goals, their well-being. Same thing with your student. That it's all about that student learning what they need to be an effective nurse. Now, how do you make a connection? Well, the first thing you need to do is have a good introduction. So usually we just say, and as Dawn and I kind of presented, hi, I'm Julie. Hi, I'm Dawn. We both presented ourselves. And that's kind of that formal, kind of professional way to present yourself. But I want you to think outside of the box here. I want you to think about doing something different. And I want you to think about maybe introducing yourself with an infographic, or maybe that you do an elevator speech for your students. I want you to really make this grand entrance when you introduce yourself to the student. Maybe you make a concept map, and you make a concept map about you, all the things and hobbies that you like to do. This helps us connect with our students. It helps them to see that we're real, that we're human. We want them to treat us professionally and respectfully. They also have to see that we're human. Now, one thing I wanted to tell you about this is, do you notice that nurse is spelled wrong? Anybody notice that? Do you notice that this is in a different language? Now, one of the things I wanted to point out, I wanted to keep these because AI actually generated these images with me. But one thing I want you to think about is we're grasping technology, and technology is changing every single day. Just because you have AI help you doesn't mean the output is perfect. So always be responsible for your preparation, responsible for the things that you do. Don't just let AI and technology do it for you. You've got to validate the information. I kept them on here because I thought it was fabulous that I generated it by AI, but they're not perfect. I would need to actually put my own spin on it and make sure that everything is validated. So let's talk about strategies to build connections. I want you to think about curiosity. Not only your curiosity, but your students' curiosity. We want to foster and we want to promote curiosity. We want to keep learning and learning and learning. I want you to think about creativity. Critical thinkers are creative. And as a new nurse educator, be creative. Have your students do an infographic. Do an infographic. Have your students do an elevator speech for you to introduce themselves. Have them do a concept map that's on themselves. And you do one too. Be creative in all that you do. You don't have to necessarily have that streamline. This is how it should be done. Active listening. We need to listen more. So we need to be quick to listen and slow to speak, because we've really got to take in how others are feeling, what's going on with others. So that way we can make sure that we're responding appropriately. Sometimes we're so busy in our tasks that we're not even listening to others, our colleagues, or our students. Think of an equal partnership. Now, equal partnership between you, your learner, their responsibility is to learn, and you as the educator, your responsibility is to teach. It's reciprocal. So one cannot occur without the other. Same thing, equal partnership with your colleagues and your faculty. It should be an equal partnership. Really show enthusiasm and positivity. That's one way we can gain trust, and we can build relationships. Fun activities, exciting activities, gaming. Students love to game. They love to use their phones. So incorporate something that's useful to use the phone in your room. Now we say that and you go, oh, I don't want them having their cell phones in the room at all. Well, it depends on the activity that you're doing. If you can show them that the smartphone is an effective way for them to learn, then get them on that smartphone and learn. Gratitude and appreciation. Remember, students are working hard. They're in that pressure cooker too. They're in that tornado too. Show appreciation for their hard work. Also show appreciation for your colleagues and them helping you, mentoring you. So we want to show that gratitude and appreciation. That keeps us positive, keeps us joy. And then I want you to think about our communication. There's a lot of incivility right now, but we want to provide communication that's civil and it's relation-centered. Sometimes we just give knowledge because we're so busy. Do this, do that. This is your homework. This is what you should be doing. But we're not building a connection, and we're not communicating for relations. And all of our communication, yes, we're providing information But if we're not communicating based on humility and really looking at that other human being, then we're not going to build that trust. We're not going to build that relationship that we need to build with others, students and colleagues. Think about inclusion. Everybody wants to be seen, heard, and valued. Think about your availability. Are you available for your students? Are you available for your colleagues? And then also that availability goes with accessibility. Are you accessible? Oh yeah, I've got office hours from 8 to 5, but we can't find you. So you're available from this time, but where are you? You're not in your office. So we've got to have accessibility to be able to be approached and feel that students can approach us, that colleagues can approach us as well. With that too, I want you to think when you're this new educator, it's different than you taking care of a client in that you took care of your client, you go home, your client can't call you up or email you, right? Unless you give them their phone number. But students are different. You give them your cell phone, they can call you, they can email you, and they sometimes think you're on duty 24/7. This is where you've got to have those and set those boundaries. Think about power balance. And there is a power balance between you and your student. And what I mean by that is, of course, you are in that authority as that professor, as that educator. But sometimes there's going to be struggles and you're going to face challenges. That single mother that has 4 children, this is the first child that's ever went to college. She's coming to your office and she is mad. She is mad because something happened. The student didn't pass a test. So you not only have to deal with students and your colleagues with the power balance, but you also have to deal with families. So there's a power balance that student is paying for this education, and parents and students are expecting you're giving it. So we have to be very careful. This also goes into power balance and some of that incivility that maybe seasoned educators or educators that are teaching different courses, like maybe they're teaching the critical care course and you're teaching the fundamentals course. There can be a power balance there where things can get incivil. We've got to be civil and we've got to make sure that power balance is not necessarily equal, but it is the scale is good and you've got to see it and you've got to take pause and prime when you see that balance is off. We also want to promote engagement, your engagement and your student engagement, and not just engagement, engaging into the activities, doing the homework, doing the assignment, but it needs to be interactive. We need to be engaged and be interactive with the student. So it's not just, I'm going to give you an assignment and you sit there at your desk and you do it, and me not providing feedback or me not walking around the room, me sitting at the desk and just grading other papers or something else for another class. We really need to interact with that engagement. And then I want you to think about courageous leadership. Being a leader, being an educator, you are a leader, but you've got to be courageous because you are vulnerable, especially in this new position. But we've got to lead with courage. Got another quote for you. And this is from Daniel Goleman, which is the one that in 1995 made a model for us to actually evaluate emotional intelligence. Self-absorption in all its forms kills empathy, let alone compassion. When we focus on ourselves, our world contracts, it gets smaller as our problems and preoccupations loom large. But when we focus on others, our world expands. Our own problems drift to the periphery of the mind and so seem smaller. And we increase our capacity for connection or compassionate action. And I want you to remember that as you're starting to really get into academia, establishing relationships with your students, with your fellow faculty, it's really important to make that connection and build those relationships. Another way that you can make connection is getting involved with your college and your university and all the things that's happening, and get involved with student activities at your college and university. They need to see that you're real. October is National Bullying Prevention Month, and I just wanted to give a shout out for this. So Unity Day is Wednesday, October 16th. Wear orange to support this initiative for kindness and inclusion. It's always fun to do a fun activity and also to unite all of us together to do those fun activities. You're building trust. You're having joy. You're enjoying just the moment together. And that's how we're going to build those trusting relationships, doing it all together as one. I want to thank you so much for attending. If you've got questions, put it in the chat. Dawn's going to put the survey there, and she's already got the survey for you. Once you complete the survey, you're going to get a certification of attendance. And then our recording and slides will be available at the registration link about 48 hours after our presentation today. I hope this information was useful. I know it's kind of, well, I've been there, done that before, but you've got to look at it in a different perspective and building and establishing those trusting relationships. Nettie Lucas will be doing part 2. We haven't rescheduled that yet, but she's going to really dive into setting boundaries and specifics that you as an educator can do to make sure that you're continuing to build those trusting relationships with your students.
Great job, Julie. Great information shared and lots of good feedback in the chat, as you can see. And just want to see if anybody has any questions. Make sure that you have access to the link above. Question in the chat. How is AI-driven nursing care affecting the nurse-patient relationship and trust? And how can we prepare our students?
Oh, fabulous, fabulous question. Well, I think that comes back to where our communication, really, we're isolated, and AI can kind of isolate us that way too. We're not getting that sense of building a relationship when we're using robotics or we're using generative AI. Here's what I want you to think about AI. We've got to embrace technology. It's here. Our students know how to use it. They're going to use it. So we have got to build a relationship with the student on how to utilize it responsibly. Just like those pictures I showed you in the presentation. So I just put in AI, give me an image of a nurse introducing herself, and it spit out an image. But that doesn't mean I'm just going to use that image. I did, but guess what? Dawn said, Julie, I don't think that's spelled right. Julie, I think that's in a different language. But guess what I did? I just put it on there. I liked it. It looked good. My eyes didn't even recognize nurse was spelled wrong. So what do we need to do? We need to show students, use AI. Let me show you how to use it. And let me show you how to use it responsibly. Validate what AI is, generative AI is giving you. Validate that robotic is administering the medication or administering whatever appropriately. So we as a society, we want to embrace the use of technology, but we want to make sure that it's accurate. And only we as humans can do that. Plus, again, we're thinking about that human side of things and building a relationship. We can build a relationship with AI by giving it prompts and it can learn from us and get better and better. But we don't have that face-to-face communication with that robot, right? So one of the things that we have learned since COVID, we're distancing ourselves from each other more and more and more. And we've got to come together and we've got to do it together. And so those opportunities where we can connect and we can maybe get have an AI type of lunch and learn with your students 1 day a week. Let's see how we can use AI. Use AI within your classroom and show them how to utilize it. that can really help. And that goes along with your patient-client relationships as well. So if we're using it responsibly, we can be that role model to show others how to use it responsibly. Great, great question. You are welcome.
Many thank
And
yous.
don't be afraid. Hazel, I don't know if you've used AI, but get in there and start dabbling with it. One of the things that we're worried about is dishonesty, right? That the student is just using AI and just using that as the paper or whatever the AI is generating. That's going to be our responsibility to show them how to use that appropriately. And we want to show them, be that role model. But sometimes it's intimidating because it's new, right? It's new. And we may not feel as an expert in AI. We don't have to be an expert, but we can see the usage of it by getting in there and using it, and then taking what we're learning from it and sharing it with the students. I will tell you, your students are going to be way more of an expert than you are. But learn from them. Learn from them. So one thing that we always think of as an educator, that we just need to educate the student, but don't forget, allow the student to educate you too. And have the student teach about AI. If someone's using AI and they know how to use it well, let them do a little presentation to the rest of your student of how to use AI. And then you're like, uh-oh, I'm scared. Everybody's going to be cheating. Or this is where we've got to teach them the responsibility of using it appropriately and effectively. Yes, Crystal, absolutely. We can learn from everyone, everyone. That's why we want to make a good connection, right? Trust also involves truth. And so we want students to feel like they can come to us with their truth. And we want them to be honest. And that's a really hard challenge for us right now in academia. That we're seeing a lot of students not be honest. But here's the thing, if we're building really good, trusting relationships with those students are less likely in their moral compass to be dishonest.
Mhm. Great information, Julie, and really appreciate you sharing, and I appreciate those participants who joined us today. Any additional questions, don't hesitate to reach out to your nurse consultant and we'll do our best to support. And your feedback is valuable, so please take time to complete the survey.
Oh, I did want to mention, yeah, and thank you, Dawn. I did want to mention the references will be available for you with the PDF in about 48 hours. But there are 7 TED Talks on bullying and incivility for educators. And I've got that link within my resources. Check those out. That was one of the reasons I kind of highlighted the Unity Day, because there's a lot of resources out there that can really help you in this climate that we're living in, really fluidly go through that in a positive light, where you are helping your students, helping your colleagues to actually tackle some of these issues.